Hello folks, in this video we are going to talk a little bit about the history and the main indications of scleral buckle in the repair of retinal detachment. It all started with Gonin in the beginning of the 20th century when he found out that the break or the hole in the retina was the main reason for retinal detachment initiation. Several surgeons tried scleral laceration on opening the sclera to reduce the pressure and try to repair retinal detachments with partial outcomes. Later on, about 1949, custodies in Germany placed a solid material around the sclera to push the hole and seal the break. That was the beginning of scleral buckle surgery. Later on, Charles Cappins and Harry Linkoff in the United States continued the progression of retinal detachment with new materials, along with Professor Indy Kreisig in Germany and Europe. With the development of postplanar vitrectomy, technique of scleral buckle remain less and less often. It happens that new surgeons are not learning the variations and the details of this technique. It is important to recognize that this technique can be precious and very useful for specific case of non-complicated retinal detachment. For example, patients with retinal dialysis, small breaks, one hole, no PVR, or even as adjuvant for postplanar vitrectomy in selected cases, including patients with inferior breaks and detachment. Naturally, for complicated retinal detachments, giant retinal tears, patients with several breaks at different locations, scleral buckle is contraindicated and patients should undergo vitrectomy alone or with scleral buckle as an adjuvant. This is a case of complicated retinal detachment which was successfully repaired with vitrectomy and 360 scleral indentation to relieve the pressure of the PVR and position the retina back to the wall. So in this video we briefly reviewed the history and the main indications of scleral buckle. I hope you like this video in this channel, which is focused for eye care professionals, especially residents, fellows, ophthalmologists, and retina surgeons. See you in the next video. Thank you.